Please tell us the story about Eddie Albert's wife surgery. You said it was the longest procedure.
The
You know who Eddie
just
Albert is?
yesterday, Sylvia came over and told me that Eddie Albert, the actor, had died at age 99. It reminded me of a contact I had with Eddie Albert. I was operating his sister at St. Mary's, and in the days of only X-ray, she had a diagnosis of a large bleeding duodenal ulcer, and it wouldn't stop bleeding. So we planned on doing the usual ulcer operation, which is removing the lower half of the stomach, or alternatively removing only the lower third of the stomach and doing a vagotomy. So before going to surgery, I told Albert that it would take about 3 or 3.5 hours. When I got in there, she did not have an ulcer, but instead she had a cancer of the ascending portion of the right colon, where it overlies the duodenum. Her diagnosis had been an ulcer of the duodenum, and the carcinoma had penetrated into the duodenum and was causing the bleeding. My assistant was Bob Schauer, and he said, "She's inoperable. We just have to close." Well, it meant that she was going to bleed out in a few days. So I thought, at least we can try. This demanded removing a half of her colon, also removing the lower third of the stomach, the head of the pancreas, and all of the duodenum.
Wow.
And because the gallbladder common bile duct and the pancreatic duct drain into the duodenum, these outlets had to be removed. It then meant bringing the jejunum up and anastomosing to the lower stomach and connecting the end of the common bile duct into the jejunum, and then anastomosing the pancreatic duct into the jejunum. Unfortunately, the pancreatic duct was only about 1/8 of an inch in diameter, and it was the most tenuous anastomosis that's possible. And yet, a pancreatic leak would be probably fatal, or at least produce a pancreatic fistula, which digests the surface of the skin. All of this took, instead of 3.5 hours, 6.5 hours. And the operation is called a Whipple operation, and in addition to that, it was also had to have the colon resection. The literature has recently several articles, studies showing that people over 65 should not have Whipple's operations because it's too extensive and they have too high an immediate mortality. But fortunately, this woman did not have any complications.
That's something.
And then died 2 years.
She what?
Died 2 years later with colon metastases to the liver.
Well, it's certainly something that all the surgery that you did to save her. For as long as you did.
That
Those
was-
2 years,
that was a
those
big
2 years are
job.
probably the most important years in her life.
How did Eddie Albert feel about it?
Well, he was very grateful. I didn't see him after that day. I came out and I told him what we had, and I told him the prognosis was very gloom, both for the surgery. But,
Yeah.
Well,
We
one of
love
those
to,
things where you don't, he never gives up.
we love to hear those stories, Dad. We're so proud of you for
And that was nicely.
all the lives you saved.
Lee and his technology.